thank you for the opportunity to speak to you this morning. I'm really pleased that we could provide some support so that this seminar could happen. I'm disappointed I can't be there in person, but I'm actually out of Brisbane today. Can I acknowledge the traditional owners of the land on which you're meeting and any Aboriginal and Torres Strait Islanders who may be in the audience with you today. I'd like just briefly to acknowledge that the rest of the world does know a fair bit about the issues that the gay and lesbian community face with respect to their mental health and well-being, and that's not to do, as you know, I don't need to tell you, it's not to do with who you are, it's to do with the discrimination which you encounter in the society that we have, and that not only impacts on people personally, but it does mean that people are far less likely to go and seek support, particularly mainstream support. The incidence of suicide is far too high, attempted suicides and suicide ideation. We know that, and we need to do something about it. Doing something about it is across a number of fronts. The peer networks that exist are great, and we need to continue to equip them because people will go to their peer networks for support. Specialist skills and knowledge are increasing, and I understand there are a number of people in the audience today with great specialist knowledge, and that needs to be encouraged. Mainstream services, though, still do need to be responsive, and we need to encourage them to be responsive. And everybody in society needs to understand the more we include and connect people, the better society we'll have and the better the individuals will be. And so in that context of telling everybody else what they need to do, the Queensland Mental Health Commission is doing something. We have a number of action plans in place that have been signed off by government, so they're actually government policy. That's suicide prevention, early intervention, which is about preventing mental health problems before they arise, intervening early, action now on addressing drug and alcohol, which looks at what government's doing broadly. In 2016, we are looking at what can you do specifically for rural and remote Queenslanders and for Aboriginal and Torres Strait Islanders. But within all of that, within the work we've done and the work we continue to do, there will always be, within that context, what needs to be done differently, additionally, so that the outcome for the LGBTI community are equal to the outcomes for everybody else. So a number of the things which you've actually already got underway, we're trying to make sure that the data, for instance, which you collected about suicide, actually looks at what does that mean for the LGBTIQ community, because we need to know, not guess, what the problems are. Queensland continues to support Beyond Blue because we believe, and our feedback is, that the work they do in stigma and discrimination is well received by you. And we have funded a number of projects through the Gay and Lesbian Association, the Queensland AIDS Council, that helps the people help themselves and help their communities. So we are enabling and building rather than doing for the LGBTI community, and that's really our approach to all communities. So that's just the beginning. It will always be on my radar. Social equity is always on my radar, and I'm sure that it is on yours. So best wishes for your symposium today. I hope lots of great things come out of it, and I hope there is something we can all learn from what comes out of it. Have a great day.